Did you know that through seemingly harmless personal hygiene habits, doctors can detect early signs of serious health issues in older adults? This situation happens quietly every day, yet very few of us are equipped with the knowledge to prevent it. Welcome to Elderly Wisdom Stories, where we share practical yet often overlooked medical tips, things that could save your life or the life of a loved one. In today's video, we will explore 7 common personal hygiene mistakes made by older adults, including neglecting oral care, insufficient bathing, improper nail trimming, avoiding issues with bowel and urinary function, as well as cleaning ears, feet, and the side effects of medication. I promise that by the end of this video, you will know how to adjust your daily habits to prevent potential health problems and maintain confidence and dignity in daily activities. So, have you ever been warned that bleeding gums or discolored skin could be signs of cardiovascular, liver, or kidney issues? Please share in the comments below any issues you or your loved ones may be facing. Let's exchange ideas to help each other prevent and support one another. Now, without further delay, let's start with the first mistake: neglecting oral care, because the mouth is the gateway that harbors bacteria which can attack the heart and brain. In reality, many older adults are using toothbrushes that are too worn, brushing their teeth less than twice a day, and completely neglecting flossing, signs that are easy to spot if you pay close attention. However, the consequences of this go beyond bad breath or tooth loss. According to research at Harvard Medical School, bacteria from inflamed gums can enter the bloodstream, increasing the risk of atherosclerosis, leading to heart attacks, strokes, and even worsening memory loss in older adults. Specifically, the research team found that patients over 65 with severe gum inflammation are 3 times more likely to suffer from cardiovascular disease compared to those who maintain proper oral hygiene. To remedy this, first, you should replace your toothbrush every 3 months or as soon as the bristles begin to fray. Even better, consider using an electric toothbrush, as studies at the University of Pennsylvania School of Dental Medicine show that electric toothbrushes remove up to 62% more plaque than manual brushes. Next, commit to brushing your teeth for at least 2 minutes, twice a day, using a stopwatch or timer on your phone to ensure you brush for long enough. Also, never skip flossing at night, as the spaces between your teeth are where bacteria are most likely to hide. Lastly, don't forget to schedule a dental checkup every 6 months so the dentist can catch any abnormalities early and address them promptly. These seemingly small changes will make a big difference. Not only will you maintain healthy teeth and fresh breath, but you'll also protect your heart, brain, and your ability to live independently and confidently. After you have strengthened your oral care habits, the next important step is to avoid the second mistake: bathing too infrequently and improper skincare. Many older adults believe that bathing once a week is enough, especially during cold weather, to avoid drying out the skin. However, this can inadvertently hide signs of serious health issues such as liver, kidney, or diabetes conditions that often cause skin discoloration, itching, or uneven dark patches. According to research from the Mayo Clinic, about 40% of chronic skin conditions in older adults could be the first signs of underlying medical conditions, and without proper observation, timely intervention may be missed. To correct this, you should establish a bathing schedule at least 3 times a week, even if you're not engaging in physical activity. This not only cleanses bacteria, sweat, and dead skin cells that accumulate, but also allows dermatologists to more easily spot any abnormalities in skin color or texture. Use a mild, fragrance-free soap and avoid stripping away your skin's natural oils, recommended by the American Academy of Dermatology. After bathing, while the skin is still slightly damp, apply a moisturizing cream rich in ceramides or glycerin to lock in moisture and maintain the skin's protective barrier. Additionally, each bath is an opportunity to check your entire body, including your back, chest, arms, and legs, for any moles, rashes, or sores that heal slowly, signs that require a visit to the doctor. In fact, according to the Dermatology Clinics Journal, 2020, older adults who follow a regular bathing and moisturizing routine are twice as likely to detect early signs of dermatological or systemic health issues compared to those who neglect skin hygiene. Lastly, be mindful of adjusting the water temperature when bathing. Lukewarm water, around 37 to 40 degrees Celsius, stimulates circulation and helps with cell recovery, while water that's too hot can dry out the skin, reduce elastin, and cause irritation. When you consistently bathe the recommended number of times, choose gentle products, and carefully observe your skin, not only will your skin become brighter and softer, but it will also help detect early health issues hidden beneath the surface. Continuing from improving your bathing and skincare habits, the next important step is to avoid the third mistake, neglecting nail care, a sign that reflects overall health, which many older adults often overlook. When you observe your fingernails or toenails and notice they are thickening, turning yellow or brown, or even being trimmed improperly, it's not just a sign of aging, but can sometimes indicate anemia, thyroid disorders, or diabetes. Moreover, thick and discolored nails provide an ideal environment for fungal growth, causing itching, swelling, and even leading to deep infections, if not properly treated. According to the American Academy of Dermatology, more than 50% of people over the age of 60 experience nail problems, and up to 30% of them discover systemic diseases through minor changes in their nails. Therefore, the first solution is to cut nails straight across, rounding the corners slightly to prevent the nails from growing into the skin, causing pain and inflammation. Next, make sure to keep the nails and surrounding skin dry and clean, as moisture accumulating between the nail folds creates a breeding ground for yeast and bacteria. Additionally, wearing breathable shoes and changing socks daily also plays an essential role in maintaining a dry environment. You should choose socks made from natural materials or antimicrobial technology, which helps absorb sweat more effectively. Also, don't hesitate to visit a dermatologist or a podiatrist immediately if you notice any abnormal signs in your nails, such as cracks, broken skin, or dark or red patches under the nails, because, according to the Journal of Geriatric Dermatology, 2019, delaying treatment can lead to deep infections or tissue damage that is difficult to recover from fully. Finally, don't forget to supplement essential nutrients for your nails, biotin, zinc, and omega-3 from food or supplements to improve strength and prevent brittleness. When you actively monitor and care for your nails every day, not only will your hands and feet become neat and beautiful, but you'll also detect early signs of potential health issues inside your body. Continuing from effectively managing nail care and preventing infections, the next important point is to manage urinary incontinence. Many older adults feel embarrassed and conceal their lack of bladder control, resorting to makeshift solutions like using sanitary pads. But this attitude can lead to severe consequences. According to a report by Johns Hopkins Medicine, more than 50% of older adults experience incontinence, and if not properly addressed, they can face skin infections, an increased risk of falls from rushing to find a restroom, and even miss the opportunity for early detection of bladder or prostate cancer. The first and most important solution is to have an open conversation with your doctor. Incontinence is not a sign of weakness, but often related to medical conditions that can be treated or effectively managed. Next, you should use products specifically designed for incontinence, absorbent underwear, adult diapers, or medical pads, instead of makeshift solutions like toilet paper or regular pads. These not only keep the skin dry, but also reduce the risk of pressure ulcers and contact dermatitis. In addition, clean the skin immediately after wetness with a pH-balanced cleansing solution and dry thoroughly, especially in sensitive areas, to prevent bacterial growth and reduce inflammation. Keeping the skin clean also makes it easier to observe any unusual changes, such as redness, itching, or odor, signs that need to be checked by a doctor promptly. Finally, it's important to realize that incontinence is not a normal part of aging. According to a study published in the Journal of Urology, 2020, if intervention is done early, over 60% of urinary incontinence cases can be significantly improved through pelvic floor physical therapy, Kegel exercises, or adjusting lifestyle habits. This not only enhances the quality of life, but also helps you maintain confidence, dignity, and independence. When you know how to properly manage urinary incontinence, you will avoid complications and fully enjoy your golden years without worrying about unexpected accidents. After properly managing urinary incontinence, the next important step is to address improper ear hygiene, as ears not only hear, but also reflect overall health. Many older adults use cotton swabs to deeply insert into their ear canals in hopes of removing all the earwax. However, according to the American Academy of Otolaryngology, this is the primary cause of 40% of eardrum perforations and many cases of ear canal infections. When you push earwax deeper, not only does it cause ear canal blockages, but it also creates scratches in the mucous membrane, allowing bacteria to enter, leading to inflammation, itching, and even hearing loss. To correct this, first, only clean the outer ear with a soft, warm cloth or sterile gauze, avoiding any hard objects from being inserted deeply. If you feel that earwax has accumulated too much, you can use specialized ear drops containing glycerin or 3% hydrogen peroxide to soften the earwax, after which the earwax will naturally flow out or can be gently removed during a shower after a few days. More importantly, you should visit a doctor immediately if you experience ear pain, discharge, or reduced hearing, as these symptoms could signal middle ear infections, outer ear infections, or even small tumors in the ear canal. A study at Johns Hopkins University, 2021, showed that over 30% of older patients hospitalized for ear-related issues were due to improper self-care, and by the time they sought medical help, the condition had worsened, preventing full recovery. This not only affects hearing, but also diminishes the quality of life, causes imbalance, and increases the risk of falls in the elderly. Finally, to maintain hearing and prevent complications, you can supplement with omega-3 from salmon or fish oil capsules, substances that have been proven to improve blood flow to the ears and reduce inflammation, according to the Journal of Geriatric Medicine, 2020. Combining gentle outer ear hygiene, proper eardrops, and regular checkups will help protect your hearing, improve your quality of life, and detect any abnormalities early. When your ears are properly cared for, you will continue to enjoy laughter, music, and loving stories with your family fully. After you've protected your ears from improper hygiene habits, we cannot overlook proper foot care, as the feet are not only the body's foundation, but also reveal many underlying health signs. Typically, older adults simply wash their feet casually, dry them insufficiently, and consider dry, cracked skin or numbness as just a normal part of aging. However, according to a study published in the Journal of the American Podiatric Medical Association 2018, over 85% of amputations in diabetics can be prevented if patients follow proper foot care practices. First, the signs you need to be aware of include dry, rough skin, slow healing cuts, skin ulcers, or a tingling or numb sensation, symptoms that should not be ignored. Dry and cracked skin provides an ideal environment for bacteria and fungi to enter, leading to cellulitis or deep infections. When numbness occurs, it could be a sign of peripheral neuropathy caused by diabetes or poor circulation, conditions that, according to Diabetes Care, 2019, affect up to 50% of adults with type 2 diabetes, leading to foot ulcers and necrosis due to loss of sensation. To address this, first, wash your feet daily with warm water, not too hot, to avoid stripping the natural oils. Use a gentle soap and wash thoroughly between the toes, where bacteria and fungi are likely to accumulate. Afterward, dry thoroughly, especially between the toes, as damp areas are a paradise for Candida fungus and bacteria to thrive. In the moisturizing step, apply a cream containing urea or lanolin to the top of your feet and heels, but avoid the area between your toes to prevent excessive moisture buildup. In addition to a proper hygiene routine, daily foot inspections are essential. Use a handheld mirror to observe the tops of your feet, heels, and soles, looking for cuts, red spots, or blisters. If you're managing diabetes, it's crucial to pay even more attention. Any small injury could lead to serious complications, and it should be disinfected and bandaged, followed by a visit to a dermatologist or a foot care specialist if abnormal signs are detected. Next, choose the right socks and shoes. Socks should be made from natural materials or moisture-wicking fabrics, and avoid tight socks that restrict circulation. Choose shoes that are roomy with enough space for the toes, cushioned soles with good grip to prevent slipping. According to the American Heart Association, 2020, proper shoes and socks not only reduce injury risk, but also support effective blood circulation, helping to prevent foot swelling due to poor circulation. Finally, to enhance foot health, you can do exercises like toe curls and ankle rotations every morning to stimulate circulation and maintain flexibility. Including omega-3 and vitamin D in your diet helps keep the skin and nails healthy. By dedicating enough time to cleaning, drying, moisturizing, checking for injuries, and choosing the right shoes and socks, you'll not only keep your feet soft and neat, but also prevent severe risks like amputations, infections, and diabetes complications. As a result, you'll continue to walk confidently, maintain your independence, and preserve your dignity in your golden years. After completing foot care, the next important issue to address is improper hygiene due to medication side effects, a problem often overlooked but can be a sign of drug toxicity or liver and kidney damage. When you start taking a new medication, your body often reacts with changes in personal hygiene such as dry mouth, excessive sweating, unusual odors, or even skin discoloration. According to a study by the American Geriatric Society, 2020, nearly 40% of adverse reactions in older adults manifest through these external symptoms, while patients, and often even doctors, fail to connect these to the medication being used. First, dry mouth not only causes discomfort when eating, but also increases the risk of tooth decay and sore throats due to a lack of lubricating fluid. Research from Harvard Medical School, 2019, demonstrated that the suppression of salivary glands by anticholinergic drugs or diuretics causes a change in the mouth pH, creating an environment conducive to bacterial growth, leading to infections and rapid tooth decay. Next, excessive or unusual sweating, especially sweating with a strong odor, could be a sign that the body is trying to detoxify through sweat glands, signaling that the liver or kidneys are overworked to metabolize the medication. A study published in the Journal of Geriatric Pharmacology, 2018, noted changes in body odor in 60% of patients using statins and blood pressure medications, whereas there were no unusual odors before. Additionally, abnormal skin discoloration, yellowing, darkening, or redness can be a sign of liver damage, jaundice from bilirubin buildup, or subcutaneous inflammation due to an allergic reaction to medication. According to the American Liver Foundation, these changes often occur earlier than symptoms like pain in the right upper quadrant or fatigue. Citation needed. To prevent and address this promptly, you should keep a journal of any personal hygiene changes from the moment you begin taking a new medication, noting the name of the medication, dosage, and symptoms such as dry mouth, sweating, or skin changes. This journal will help doctors easily identify the cause when assessing your symptoms. Additionally, immediately inform your doctor if you notice any abnormal signs and never stop taking the medication on your own, as doing so may lead to reduced treatment effectiveness or cause other serious side effects. Finally, make sure to stay hydrated, at least 6 to 8 glasses a day, to support better detoxification by the liver and kidneys and reduce dry mouth. If allowed by your doctor, you can use sugar-free chewing gum or specialized mouth sprays to stimulate saliva production and apply moisturizing lotion to your skin to prevent peeling and dryness. By closely monitoring and promptly reporting to your doctor, you not only avoid complications from accumulated toxicity, but also maintain healthy personal hygiene habits, protecting your health and preserving your dignity in daily life. We've just explored 7 common personal hygiene mistakes that doctors can easily spot in older adults, from oral care, skin, nails, to managing incontinence, ear and foot hygiene, and monitoring medication side effects. Making adjustments today will not only protect your health, but also preserve your confidence, independence, and dignity every day. If you found this video helpful, Please like to support, subscribe to the Elderly Wisdom Stories channel, and turn on the notification bell so you don't miss out on the next senior health tips. Also, don't forget to share your stories or questions about hygiene issues in the comments below. Together, we will support and inspire the community. Thank you for watching, and see you in the next video.